Everybody should know that breast cancer is not one disease. Any pathologist could tell you that there are at least 25 different subtypes of breast cancer, which we, in one term, call breast cancer. These are very different in histology. They look very different on the mammogram. But can you imagine there is only one imaging tool and you expect that it images all 20 different subtypes equally well? As if I was giving you one gun and I was lining up 20 or 25 different types of animals, let's say a small bird and an elephant and anything in between, and I would expect you to shoot or kill all of them. We cannot. So we have to be very sincere with women by saying that mammography is an extremely good imaging tool. It's proven lifesaver. However, this is the way to think about it. It's very, very good, but it's not perfect. And it's natural because of the different subtypes have different mammographic appearance, as well as depends on the environment. That is, if it's an adipose tissue or a dense tissue, they are going to be, there will be a limitation. Therefore, we are using another imaging tool. It's called ultrasound. You know, ultrasound is like a radar helping the pilot to go through the thick cloud without accident, or in order to avoid accident. And then we have the interventional tools. That is, as soon as we see something on a mammogram or on the ultrasound, then we are using fine needle aspiration or larger bore needle biopsy. And then when we establish the diagnosis, we really have to try to determine the extent of the disease. And that's when a functional imaging method, quite new technique, the magnetic resonance imaging of the breast, comes into play. So, you know, the heterogeneous nature of the breast density, the heterogeneous nature of breast cancer and the other benign breast diseases makes us to stretch our hands once to mammography and ultrasound, once mammography, ultrasound, and MR, once just mammography, or to the interventional methods. Treatment planning is going to be very much determined by the finding of one, the other, or the summary of all these examinations.
Hi, I'm Dr. Jay Harness, and I want to share with you important information that I believe that every newly diagnosed patient with breast cancer needs to know.
I'm a breast cancer survivor.
I am a breast cancer survivor.
I am a breast cancer survivor.
And I want every woman to know
About personalized breast cancer treatment
and the genomic test.
A test that helps guide a woman and her doctor
to the best treatment options for her.
Pass it on.